The topic of this video is dental ignorance and what you don't know can hurt you. And this is absolutely true. The reason I'm writing this is because several years ago, after I wrote my book, What You Should Know About Gum Disease, I ran into a plastic surgeon and, I told him what I was doing with my book. And what he said to me was, prevention doesn't pay. What he was trying to say is you can't make any money at all by teaching people about prevention. And his comment made me very sad because to me it was a reflection of his own thought process in that, you know, you have to provide, quote, treatments, right? Have you ever noticed that in the modern world, all these professionals talk about treatments, but they very, very, very rarely talk about cure, right? Have you noticed that? It's all about treatment. Let me treat you. Let me give you a special treatment. But what does that mean? It means maybe you weren't cured, and it means maybe in 1 to 3 years you've got to come back and get that treatment again. Think about how many times you hear the word treatment from these professionals rather than cure. Just stop and think about that for a minute because it's a very important point. And the point is, perhaps, if you accept it, that you might want to delve deeper into things. Don't accept what's given to you on the surface. And the same thing with all of your schooling, all the way through from kindergarten to graduate level studies. Don't be content with what you're taught. Always, always, always dig deeper. It's the same across the board for all topics, not just dental related ones. It's really true. There's always, almost always, probably always, there's always more to understand, always more to uncover. Look beyond the basic facts that you've been told. Sometimes those facts are not actually true. And when you delve deeper and deeper and deeper into things, you start to see where they're not always true. Maybe they're true sometimes, and that's why some people call them facts, but maybe they're not always applicable, and maybe they don't always apply. So this is a very important lesson in life. Always dig deeper. Don't accept what's given to you on the surface. Unfortunately, what this doctor said to me turned out to be fairly correct in one sense, not in the sense that I just talked about, but in another sense. And that sense is that people are not going to listen to you until they are facing a major crisis. And even then, they won't listen. And a conversation I had yesterday comes to mind. And even though I laid out the basic principles over and over and over again in this conversation, it was clear to me by the end of the conversation that the person didn't understand, didn't get the basic principles that probably could save her a lot through prevention. But it was lost. All the information I gave for free was lost on this person. So far. Maybe they'll come back. Maybe they'll wise up. I don't know. But what will end up happening is that people will end up spending thousands of dollars for solutions that are only short term. You can lead a horse to water, but you can't make it drink. It's the same concept. It's almost like ancient wisdom. It really is. So when he talks about prevention not paying from a certain perspective, he's right. Because people won't listen until it's time for something drastic to happen. And it's very, very unfortunate because many of these expensive bills can be prevented. But only if the person has a little bit of knowledge and is willing to take a little bit more action. I learned a lot about in my own research about this particular topic on dental health, and this particular topic is gum disease. And unfortunately, 75% of people, according to dental professionals, many of them will say this, have gum disease right now. Ask a dental hygienist. They see it every day, day in and day out in their practice, and so do the dentist. This is an extremely prevalent problem that has been with mankind since day one. The problem is it's very quiet, most of the time. It doesn't progress right, it progresses slowly. But the problem is, it is the biggest cause of tooth loss. What happens when you lose a tooth? You need an implant, or you need dentures, or you need some solution. You can't leave a hole in your mouth because the teeth will shift around, and that brings a whole nother set of problems. So a lot of people are going to end up with expensive dental treatments, and they're going to shell out thousands of dollars to find out that in a few more years, they're going to have to shell out thousands again because the problem was only temporarily addressed and temporarily arrested. What's important to realize is that the prevention of these problems is a daily issue, right? You can only go to your dentist a few times a year. Maybe you get your teeth cleaned 4 times a year, right? Most people don't do that much, but some people do. And getting your teeth cleaned more often is helpful from a certain standpoint. But the problem is it enough? And again, if 75% of people are facing gum disease, say you do your regular brushing and flossing every day, right? Is that going to protect you? Well, think about it. If that was going to protect you, why do 75% of people have gum disease? Are you telling me that 75% of people don't brush and floss their teeth every day? I don't believe that. Sorry. I'm quite sure a significant amount of people brush and floss their teeth every day. And yet, 75% of people still end up with gum disease. What does that tell you? It tells you that for most people, regular brushing and flossing is not the end of the story. It's not enough to prevent these problems. For some people it is, right? For some people that's all they need to do. But it's not true for most people. Because if it was, it wouldn't be 75% ending up with gum disease. Most people have it right now, they just don't know it. Nor would they believe it if you told them. So eventually they're going to end up needing expensive dental treatments. And they don't realize the prevention of the problem is a daily issue. As humans, we really look at things in a strange way, don't we? Here's an analogy for you, okay? Think about this. You never change the oil in your car, ever. Nobody ever told you should do that. You never thought about it. It never crossed your mind to ever change the oil in your car. So you go to the mechanic once every 2 years because your engine blows up on you. It's destroyed. Okay, maybe it didn't blow up, it broke down, let's say. The mechanic changes your engine for you. He knows in his mind the reason this engine was destroyed is because you never changed the oil. So he changes the engine for you, and he'll be happy to do it again in another couple years. All the while, he knows that if you just change your oil, everything would be great, and your engine would last for a long time. But even though he mentions it to you in passing, right? Maybe he just briefly mentions to you, you might want to change your oil once in a while. To ease his conscience, right? He never fully explains the concept. He just tells you, maybe you should change the oil once in a while. But you never get it. You don't think of it. It doesn't register in your mind. In a couple years, you're back there again getting another engine. Thousands of dollars down the tubes. The only problem with this analogy, even though it kind of fits, is that we're just talking about a car here. Once you lose a tooth, what are you going to do? That tooth is gone. It's not coming back, right? Now, on a side note, I'll just pause here for a second because this is important. There are researchers out there that have figured out how to regrow teeth. If there's a little bit of a root left, they can use electric stimulation to regrow a whole tooth. But I bet you never heard about that before. You can look around. That information's out there. And these studies were done years ago. And yet, it's not part of the mainstream awareness, and it's not part of commercial dentistry. And you can ask yourself why that is. So, you're going to end up spending money on an implant or dentures. There's really no good substitute for a good tooth. No artificial substitute is going to be as good as the real thing. And so it said, just like an engine, you end up replacing your engine out of ignorance, you end up losing teeth out of ignorance. So, unfortunately, I have to concede, because I resisted this idea from the beginning about what this doctor told me, that prevention doesn't pay. Unfortunately, I have to concede that he's right. Trying to teach people about prevention doesn't pay. It really doesn't. People don't listen. Prevention does pay someone, though. It pays you as the individual, right? Because if you can avoid thousands and thousands of dollars of treatments trying to save your teeth, and then the thousands of dollars it costs replacing them when you do lose them, that's where you get paid, by focusing on prevention, by avoiding all that. And not only that, but it's the pain that you get past, the pain that you get to avoid. It's just a strange world we live in, isn't it? It's very strange. Prevention pays the patient. Prevention doesn't pay the professionals who do thousands of dollars of work on your mouth. But it pays you as the patient. So let me ask you a question. I've talked to you about dental health prevention today. This resource that you see on your screen in front of you is a really good one. I wrote it. Okay, maybe I'm prejudiced, but I really think it can help you. And when you talk about 3 out of every 4 people, 75% of people having gum disease according to professionals, there's got to be at least 1 or more people in your family, perhaps you, who could benefit from this information. Now, we just talked about prevention not paying and the reason why people don't pay attention. So let me ask you this question. Are you just like everyone else? Let me know the answer in the comments below this video. Let me know the answer because I'd like to know. Are you just like everyone else? Just comment below and let me know what you think. Thanks for watching.